Hello, my special interests are plain language and health literacy. In this presentation I offer some suggestions for using plain language in healthcare relationships. We're all healthcare consumers, so a talk about plain language is for you. And if you're a healthcare provider in your own practice or a larger organisation, I hope you find something here to support your work. I use the word consumers for people who use healthcare services to include a community wider than just patients in a hospital. In May of this year, healthcare providers in New Zealand attended the first New Zealand Health Literacy Conference. We didn't just talk about health literacy, we talked about what we're doing around the country to improve the health literacy of New Zealanders. At the end of the conference, participants agreed that health literacy was everybody's business. Improving health literacy saves money, it saves time, and it saves lives. Here's a little bit about us in New Zealand. Over half the adult population in New Zealand has low health literacy. We share this statistic with many other countries. And we also share the challenges of providing accessible health information. But in New Zealand, we have a code to support us. We have the right to health information that we can understand. Our Code of Health and Disability Services Consumers' Rights, 1996, gives us the right to information that we can understand and use. The right to the environment for an open, honest and effective conversation between a health provider and a consumer. And the right to being informed so that we can make good decisions about our own health and our family's health. But health information itself can be complex. It has its own language. It's personal, affects everyone. And there's an overload of information available, so we have to choose carefully what information to use. Into plain language. Here's how plain language fits with health literacy. The internationally accepted definitions of health literacy focus on the ability of consumers to obtain and use health information, and the ability of health providers to communicate information clearly so that people can use it. I also like the descriptions of health literacy in this slide, that health literacy is the communication component of healthcare, and that healthcare is effective when the person giving the information and the person hearing or reading the information understand each other. These descriptions focus on the partnership between consumers and providers, and they give plain language an important role in healthcare. Because having good health literacy is not about knowing all the medical words. There are, of course, some medical words we need to know. But a health provider can explain the words a consumer needs to know. If you have osteoporosis, for example, you need to know the word osteoporosis and what it means, and the other words that go with your treatment. Plain language can explain what you need to know. So for a consumer, having good health literacy means knowing how to ask the questions. It means knowing what questions to ask and how to have a conversation with a health provider to get the information you need and the support you need. For the health provider or organisation, health literacy means that as well as giving people information, you may need to teach people that they have a right to ask questions and certainly the right to understand. You may also need to teach people the questions to ask to get the information they need. Health providers and health consumers need to understand each other, and the language they're most likely to have in common is everyday familiar words. So what can a health provider do to improve a person's health literacy? A health provider is part educator, part interpreter of the language called medical terms, part facilitator, and part promoter of health. So first of all, try to reduce the complexity and the information demands any way you can. Here are some suggestions. Review your forms and fact sheets. Make sure they're easy to read. Teach the important medical words, but only the ones people need to know. and then find some plain English alternatives for the other ones. Check people's understanding with teach-back techniques. You can research teach-back on the internet to learn a technique that fits with your kind of work. Limit your information to 3 pieces. That's about as much as most people can remember in one sitting. Offer to help someone fill in forms, particularly if they seem to be struggling or if they make excuses not to fill them in. And develop a dual language for your scope of practice. A medical language and a plain everyday language. So what elements of that plain everyday language are useful? First of all, think of your reader or your listener always. Make your purpose clear so that a person knows why it's important to understand. Structure the information so that it's logical and easy to follow. Give the main message first, then the action you want them to take, or tell them what they need to do, and last of all, the details and the extra information. Then if they forget some of the things that you said, they may remember the first important message and what they need to do. Use everyday familiar words. Explain the medical terms that are important, and then you can use the terms. And get the tone right. Be friendly but professional. What can a health organisation do to support the health literacy of its community? A health organisation reflects the community it cares for, so it needs to have strong relationships with the people who use it and other organisations in its community who take care of those people. How can an organisation build the health literacy of its community? An organisation can create an environment where people feel free to ask for help or say they don't understand, even when everyone seems busy. You can use plain language signage in the building so that people can easily find their way. They can review existing forms and fact sheets to make sure they're easy to read. And when they write new ones, they can user test them to ask people if the information is clear. They can encourage health providers to use plain language in their conversations with consumers. I've suggested some behaviour changes for health providers and organisations. Our consumers can do a lot to contribute to their own better health care as well. Here's some suggestions for consumers to become more health literate. Consumers can learn to ask questions. The set of questions called Ask Me 3 is a good place to start. The 3 questions are: what's my main problem? What do I have to do? And why is it important for me to do this? There's a lot of information on the internet about Ask Me 3. Consumers can also use their right to ask for help when they don't understand. It can be helpful to bring someone with them to an appointment, to be their eyes and ears, or to ask the health provider to draw a diagram or write down information they think they may not remember. And finally, they can find their own plain words to explain their health problems and what they need to do, so that they have some feeling of managing their own health. It's not easy to change the literacy of generations, but we can change the way we all talk. We can talk healthcare in plain everyday language, and we can create an environment where health providers and health consumers can communicate openly, honestly and effectively, as the New Zealand Code of Consumers' Rights tells us. Thank you for your time.